Hi everybody, my name is Sheila Tai. I am a third year and one of the chief residents at the University of California Davis Family and Community Residency Program here in Sacramento, California. So who we are, there are a lot of us. There are 45 residents. The incoming class will have 10 categorical family medicine residents, and then we have 2 combined residencies that are family medicine psychiatry and family medicine OB. And so we have a lot of colleagues that we get to work with that are then double boarded. And so that gives us the opportunity to learn a lot from them and kind of helps marriage the programs of psychiatry and family medicine and OB. So that's one unique thing to our program that I actually didn't even know about until I matched here. But I've really, really enjoyed working with them, and I learned so much from them. They're really a wealth of knowledge in clinic and on rotations. The other thing I love about having such a big diverse class is that there are so many of us with so many different passions and special interests that we also get to learn about from one another. And one thing our program does really well is train us to do a variety of things. So whatever you want to do after residency, I think UC Davis does a really good job of preparing you for that. Whether you want to go be a rural doctor, or you want to be a hospitalist, or you want to do urban underserved, or you want to work at FQHCs, or you want to work in academics and do research. The diversity in both our residents as well as our faculty really helps foster and support that. We have faculty that are really passionate about a lot of different things like hospital medicine, addiction medicine, reproductive health and abortion care, academics, research. And so whatever your interests are in family medicine, I'm sure there's someone here to help support and mentor you. This is our hospital. So it's a 625 bed hospital here in Sacramento, California, in the smaller city of Oak Park, right off the freeway. It is the #1 hospital in Sacramento, and it is the only level 1 trauma center in Sacramento as well. It's also a children's hospital. It has a PICU, a NICU, a children's wards, a children's ER, as well as 23 other residencies and fellowships. And this is who we serve. So if you look at this map of California, this area in red highlights all of these counties, which serve about 6 million residents and 33 counties. So UC Davis has a huge catchment area. Basically, anything in Northern or Central California, east of the Bay Area, we take care of those patients. So it's really, really great. I think it makes it so that we get a lot of bread and butter medicine, but we also get a lot of experience doing a lot of tertiary care and getting a lot of transfers from hospitals and providing high-level academic medicine to a huge, huge breadth and diversity of patients. Something else that I really love about our institution, as well as the family medicine program here, is our dedication to the underserved. So the reason why UC Davis Hospital isn't in Davis and it's in Sacramento is so that we can serve the communities that need us most. And when I started here, actually, UC Davis was under the leadership of different people who had different motives. So we actually didn't have any Medi-Cal contracts. Leadership changed as soon as I got here. And then within our own family medicine program, we recognized the need for us to develop our own relationships outside of the UC Davis system so that we could continue caring for our communities. So within a year of getting here, we went from not being in any FQHCs to being in 3 FQHC systems. And so now we work and have continuity clinics, both at Sacramento County Clinic, which also has a refugee clinic. And so a lot of refugees coming from Afghanistan, from Ukraine, Moldova, Iran, Iraq, they come through. Their first interaction with medicine in the United States is in this clinic. And then we're also at One Community Health and Communicare, which has, they both have several sites in the Sacramento area, and both rural and urban underserved medicine. In addition, our chair and our leadership in family medicine played a huge role in advocating for UC Davis to now have a Medi-Cal contract with a managed Medi-Cal plan. And so we now do take Medi-Cal, which is great. This is a very pretty color-coded slide of the PGY1 curriculum, which has recently changed because we were part of the Clinic First initiative, which is a new, and probably with like the future of family medicine training is gonna look like, by integrating and kind of maintaining that when you're on inpatient rotations, you are doing inpatient medicine. When you have outpatient rotations, you're doing outpatient clinic rotations. And that allows for both continuity of care for your patients as well as supports your residency training so that you can really focus on what that rotation is at that time. Something else that I love about our program is that we are really team-based, and we really have a good inpatient and outpatient training settings and really great relationships with all the other programs. So like I said, there's 23 other programs. There's a lot of residents at UC Davis, but we have really great relationships with all of those programs so that when you're rotating on peds or OB or any of your other rotations, you're really treated like a member of their team. You're not like, oh, the family medicine resident. It's really, really a welcoming and supportive learning environment. And I really enjoyed all of my rotations, even like the ICU, the attendings there, even though it's this like giant, wonderful academic center, they're really down to earth and it really feels like a community hospital. For example, Dr. McGee, one of the internists, dressed up as our attending on Halloween as a giant inflatable dinosaur. And that's how we did rounds. So we like to have fun, we like to learn, and we like to really support each other. Something else that's really important to us here, especially being in the capital of California, is advocacy work. So here in the top right-hand corner, our residency leadership last Christmas kindly and graciously donated their own money so that we could make care packages for people who live outside in Sacramento, and we were able to distribute that to them. In the bottom left corner was one of our didactic days last year where Dr. Lee took us to the Capitol, just 10 minutes down the road from our hospital here. And we got to listen in on one of the healthcare committee's hearings of some new health policy and legislation that was trying to be passed. And we kind of just learned about like, what does it take to write legislation to make health policy, and how can we be involved in that process and advocate for our patients in that way. We're also a READY program, which is a special grant for family medicine residents and residencies who want to train in reproductive health care. So that means everything from contraceptive care to abortion training. So that's something that we also really like to advocate for here. And then lastly, being in Sacramento, we also have great proximity to the California Academy of Family Physicians, and they have a lot of ways to get involved in healthcare policy, lobby days. We also have a very active Sacramento Valley chapter of the California Academy of Family Physicians that you can get involved with. These are a couple of other pictures of us at various protests and advocating in that way. This top right corner is one of my favorite pictures of Zola, one of our family medicine psychiatry residents, who was speaking to a group of over 500 physicians at the Capitol here for one of the Black Lives Matters protests after the brutal killing of George Floyd and many, many others. And then this bottom picture is a picture of Dr. Ian Kim with some medical students, attendings, and residents who went down to San Diego advocating to end the detention and separation of families for immigrant children in detention centers, as well as flu vaccinations. Something else that is very important to us, of course, is wellness. We know residency is hard and we are a family and we're here to support each other. So something that we do every week after our didactics is weekly resident socials. And we also have monthly intern support group and Valent group where you get to kind of share and process whatever you're going through with your residency class, and gives you kind of that time and space to debrief for things when they're really hard and you don't really have time on some rotations to do that. And so we really prioritize your emotional health and our own mental health in going through a lot of difficult situations as medicine proves to have. We also have quarterly wellness half days where instead of didactics, you can go to the lake, you can go get your car serviced, you can go hang out with your family, do whatever you need to do. And then we also have annual resident retreats. Something else, if this is for you, we have a lot of support services being an academic institution for research. And since it's such a large campus, again, if you're interested in researching something, there's probably someone else on this campus that is also interested in doing that and can help you achieve that. These are a couple of our past residents who've presented their research at national and international conferences. Actually, this is Cassie down in Argentina, and this is MK at National Conference. And we are an older program, so we are established. We've had over 50 years of residence here at UC Davis in family medicine, and some of our graduates have gone on to do awesome things like work at the USPSTF, the CDC, be the program director of Duke and other residency programs, be CEOs and CMOs of FQHCs and medical centers, as well as the Gender Health Center here in Sacramento. And then just a little bit about why Sacramento. So I'm a little bit biased. I grew up here. I did all my training in Los Angeles, and then I very willingly and voluntarily moved back because I love Sacramento so much. And it's really evolved into a really special place. People call it the Midwest of California because everyone is so nice. And it's really, as you can see here, there's a lot of trees. It's a true city, but it has really the feeling of being in a town. Everyone is just really nice and really friendly, and it's really easy to make friends here. And then there's also just a ton of nature around, which especially with COVID, our extracurricular activities are pretty limited. But with how much nature we have around, we've found ways to get outside and stay social and stay sane. So this is a part of the South Yuba River that I really love going to, and I went to with some of the new interns a couple of weeks ago. There's like swimming holes, and you can whitewater raft and kayak or just lounge out on the rocks here. This is a picture I took in Tahoe last season at Heavenly, and there's a ton of ski resorts, and Lake Tahoe is huge and beautiful as world-class skiing, snowboarding, camping, hiking, anything you can do outside. You can pretty much find a place to do it in Tahoe. These are a couple of my other favorite pictures. Sacramento is also really close to a lot of wineries. It's close to Napa, but it's also close to places like Amador, where this was, that looks like Napa, but is free wine tasting. This was me and a couple of other residents. There's a cardiologist, a neurologist, a couple of IM residents, and a couple of family medicine residents and their spouses last year there. A couple hikes. There's a ton of lakes around here too, where we go paddleboarding and kayaking on the weekends that are like 10-15 minutes away, so that's really nice escape. And then this is one of our favorite breweries that we like to go to as a residency class that is still open with social distancing. And then this is the Golden One Center where the Sacramento Kings play, whom I love despite how terrible they are. And we got to go to a couple of games as a residency program as well. So thank you so much for listening. We're happy to answer any and all questions that you have. Our emails are all on the website, or you can talk to Roz, whose email is on the website, and she can connect you with a resident with your interests and who can answer your questions. Best of luck. This is an exciting time, and we hope to see and meet you soon. Thanks so much for listening.